A new national survey reports the idea of doing more with less is taking a toll on the health of U.S. workers, causing burnout across the country. The U.S. findings were also supported by a European study conducted by researchers from University College London. Their study indicates people who have highly demanding jobs and little decision-making freedom are 23% more likely to have a heart attack compared to their less stressed peers. Researchers followed nearly 200,000 people from 7 different European countries that had no previous coronary heart disease and found that stress does increase the risk of a cardiac event. The specialists at Florida Hospital Waterman Heart Center explain how your lifestyle choices can affect your chances of a heart attack.
Cardiac disease is frustrating in that sense. There are about 7 different elements that contribute to cardiac disease: diabetes, age, gender, people who smoke, don't exercise, lipids, stress, and so forth. And about 1/3 of them are things you have no control over. But the other 2/3 are things that you have control over. It's just the challenge of educating the patients and having them take what I would call the personal responsibility for their care, because we all have a tendency to kind of shuffle it off to the people around us. Well, if I see my physician, they'll take care of me, or when something breaks, they can fix it.
If you smoke, quit smoking. If you never start smoking, don't start. Obviously, tobacco is bad. First hand, second hand is obviously a bad thing. Anybody, obviously exercise, is a good thing you can do. And try to eat healthy. I know we're all gonna eat certain things that are not that healthy, but obviously try not to exaggerate it. Try to eat a lot of fruit, vegetables, have a balanced diet. If there's any family history, be sure you know your cholesterol.
But what I have found to be a very helpful example is talking about patients and their hearts like taking care of their automobile. And one of the most common phrases or points I'll discuss with the patients is, I'll buy any car that you want, but that's the last car you get for the rest of your life. I said, how would you take care of that car differently than the way most of us take care of cars now? I said, that's the same thing about your heart. I said, this is the one heart you get for the rest of your life. How are you going to take it that differently? So you'll do things that you don't normally do. You'll read the manual. You'll make sure that the oil gets changed exactly when it's supposed to, because once that car is gone, life changes. And once your heart gets irreparably broken, life changes. And they tend to connect with that more times than not. It helps a little bit.
You'll learn more about the services available and be able to view past Waterman Heart Center stories when you click the Stress and Heart Disease StoryLink icon on our homepage, yourhometownhealth.com.